of New York that has students all over the world. So we have various of those students here, including, which is a sign of the times, several who, although I've been teaching them for 8 months or so online, I've never met. Which is always a great thing to get people back together in person. So we have that programme. We also have people who are involved in what a year ago I was slightly embarrassed to call the Global Open Source Electronic Health Records Initiative. I'm slightly embarrassed because it seemed a bit grand to be doing it that. And we launched it last year, almost exactly a year ago at Fordham at a dinner, slightly bigger than this. And here we are a year later, where amazingly, we'll find this week, I hope, we've assembled the people to make global open source electronic health records, including people from all the places you might imagine would benefit from that. So particularly, I won't embarrass everybody without my name, but we have Williams Ojoba from Nigeria, who's representing the African Digital Health Research Institute. And as with a number of people who were due to be here, his colleagues are still battling their visas, but I think there's 2 of them on their way as we speak, yes. Which is great. Also, we have 8 from Rivne in Ukraine. And actually, in many ways, it was in Ukraine which started this initiative off. I first visited there 2018. And visited quite a lot, doing health records and what we call digital health, and then took a break for fairly obvious reasons. But last July, I was in Moldova with the World Health Organization, with colleagues who had similarly been working in Ukraine, and I had not even thought to go back to Ukraine until I was speaking to people who had been continuing to work in Ukraine. So I thought, well, why don't I? And here we are. We've developed already in the space of a year what I expect this week will turn into some really positive initiatives in Rivne, but also generally for Ukraine in digital health, in terms of the standards used for exchanging information, enabling telehealth, links with the university in Rivne and the technical college in Rivne, all of which will be, I hope, positive contributions. And then not just in Ukraine, in Africa, in Pakistan we have students who, none of whom were able to get their visas to get here. Dominican Republic, represented here. Ordinarily, I would be congratulating people for getting here from the USA and Canada, but that seems a little bit easy peasy. Sorry. But this is the week where that will all come together, and then next Saturday, I feel slightly bad saying this, so some of you won't be here, but quite a lot of you will be returning to this room in a week's time, us having spent the week both studying state-of-the-art in health informatics and learning how to make model-driven electronic health records to be installed, we hope, in all the aforementioned places. So that's a sort of explanation of why we're here. That's probably enough. Just to thank everybody for coming, if you've come. Some of you have come a few hundred meters, considerably longer than that. Thank you for taking the effort and trouble, some of you considerable efforts to get here. And I shall now turn over again to St. Giles. I put on the table some postcards which with the painting by my son Freddie. And on the back it's scribbled sponsorapipe.com, so if anyone wants to spend £25 or more sponsoring a pipe for St Giles' new organ, here's your opportunity. But particularly if you know people who sponsor a pipe for £10,000, then give the postcard to them, and that will get us some way to their new organ. And I think that Zihan is about to demonstrate what good use such an instrument will be put to. Thank you.